She converted her practice to membership to spend more time with people using a holistic root approach to reverse disease more naturally instead of using a pill for an ill. So please welcome Ms. Myra.
Well, thank you. I appreciate everyone having me here. And so I just didn't know, do people know how much we spend annually in the United States on healthcare? Would you believe that it's $3.8 trillion a year annually? And would you think that if we're spending this kind of money that we would be in the top 10 healthiest countries in the world? Well, we're not in the top 10 or the top 20 or the top 30. We're actually number 40 in the world as far as for healthcare. And so what's happening is that we are spending a lot more money, but people are getting sicker. And what I would consider this is really is a healthcare crisis. So by 2023, we are expected to spend up to $4.2 trillion a year in healthcare. So not only that, but our life expectancy is going down. And in fact, from 2019 to 2020, our life expectancy went down 1.5 years. This is more than ever happened since World War II. So our country is now having an epidemic of chronic diseases. So 6 out of 10 adults in America have at least one chronic disease, and 4 out of 10 of the Americans will have 2 or more chronic diseases. And these chronic diseases are the leading cause of death and disability, but it's also the leading driver to this $4.2 or $3.8 trillion spend that we're on healthcare. So in the United States, the chronic diseases, well, one of them would be diabetes. Another one is heart disease. And just think about anybody that you know that has at least one or more of these. Also, cancer and mental illness, Alzheimer's, dementia, or Parkinson's, or even autism, and the opioid crisis. So this is not what we call health care, I would say, but sick care that we're having in America. So diabetes is the number 1 chronic disease, and it is increasing. From 1997, you can see how high this is just rapidly increasing in the number and percentage of people with diabetes. And this is just up to 2015. But the number 1 killer in America today is heart disease. And you can see in all these areas where the concentrated red is where the highest amount of heart disease is. So not only that, on top of having all these chronic diseases, about around 2014, I started seeing that medicine started to change. Insurance decided that they were going to start decreasing reimbursements. Well, when this happened, the independent practices, like myself and doctors who just had their own practice, were starting to have a hard time covering their overhead. And at this point, there was a lot of talk about hospitals and corporations buying independent practices. And so at that point, it started happening that people started saying, there's something wrong, our system is broken. And so independent doctors started to go with hospitals and corporations. But when this happened, what it brings us to today is that, I'm not sure how many of you have experienced this, but most people when they go to the doctor, they will have around 12 minutes, if they're lucky, for an office visit. And not only that, it takes a long time to get appointments now. So why do you think this is? Well, as mentioned, when the hospitals and corporations started buying the practices, it started getting corporate medicine, and they started buying up the doctors, telling them what to do. They said, you need to see more patients, which means that there's going to be less time spent with them. And they put more administrative burden on them, and the doctors lost autonomy. And what this leads to is less quality care. But it also causes more sickness. Now, when I was growing up, this is not how I saw medicine practiced. So, in my background, I grew up in a small town in southwest Louisiana. Both of my parents were allopathic physicians. My mom was a general practitioner who delivered babies, and my father was a surgeon. So, though I wanted to be a veterinarian, I decided to follow in their footsteps and go to LSU Medical School in New Orleans. And after I graduated from medical school, I decided I was going to do an internal medicine residency, and also did emergency medicine, which I loved. But then around 2001, I decided to open my own practice. And back then, I could sit and listen to patients and spend as much time with them. And I really loved being independent. And because I owned my own practice, I wanted to stay that way. So, in listening to the patient, Sir William Osler, the father of medicine, said that if you listen to the patient, 90% of the time, you will find out what's wrong with them. They will actually tell you what's wrong with them. But this day and age in medicine, what's happening is that most doctors will interrupt the patient within 11 seconds of the visit. Now, this is not how I wanted to practice medicine, so I started looking for a different model. I wanted to stay independent, and I knew that there were other doctors that were enjoying practicing medicine still, and they were not getting burnt out, and they were really able to cover their overhead and spend time with patients and not be rushed. So I started looking into this, but the problem is, in medical school, you have no formal business training. And on top of that, we definitely had no marketing experience. And so doing all this was much harder than I thought to convert my practice, because as a doctor, we didn't do any of these things. So what I did is I started seeking other doctors and asking how they did it and patterning their way of how to do a membership practice and stay independent. And so basically what a membership practice is taking less patients, and they would pay a membership fee, and so they would be part of my practice. And with that, I could spend as much time as I needed with them, and also they had after hours access when and wherever they were. But along the way, while I was going to these conferences learning about this, I went to another conference, and I heard, well, this is one of the concierges talking about having more time and more access for the patient, really focusing on wellness and prevention instead of just giving a pill for an ill, and which means less prescriptions, because you keep people healthier. They stay out of the hospital more, they're not going to urgent care, and it's really focusing on more health care than sick care. So along the way, when I went to this conference, I heard about a new type of medicine called functional medicine. And this was very foreign to me. Like I said, I was very traditionally trained in the allopathic way. But when I heard these doctors, these very famous, smart, brilliant doctors that were talking about a new way of medicine that was really getting to the root cause of patients' issues and treating them more naturally and finding out the why they have their problem. It's a more natural or holistic approach, and it was really combining traditional medicine or allopathic with more naturopathic or natural medicine. And then this is instead of just using a pill for an ill. So it's getting to the root cause. And what does that really mean? So here's the root cause, and we have all these issues that are going on inside of us, and then it comes up and these root causes will express themselves as diseases. So in my journey, I decided that I would start learning about this. And what's funny is that one of the things that we learned in functional medicine is that food is medicine. So we always grew up knowing that you are what you eat and things such as this. But what's funny is that in 400 BC, Hippocrates, one of the fathers of medicine, would say, "Let food be thy medicine, and let medicine be thy food." Well, what's funny about this as well is that with Hippocrates saying all this, in medical school, we only had maybe 2 weeks of training in nutrition. So what's I think is ironic is that to graduate from medical school, you had to pledge the Hippocratic Oath. So it was kind of like the opposite of what they were teaching. So the difference that I'm going to talk about is conventional medicine. And I'm going to tell you that I'm not against conventional medicine. I was trained that way. I practiced that way for over 25 years. And, you know, and conventional medicine is still good for like emergencies, like a broken bone or a heart attack or anything such as that. But what I'm trying to say is that we really need a different way of medicine instead of just treating and being sick care and treating chronic diseases is reversing the way. So this is why finding functional medicine was more health-oriented instead of disease-oriented. It's more patient-centered instead of just like the doctor saying this and going to all these different specialists and experts and different whatever they specialized in. So it's more, people are not treated the same way because we know no two people are the same. So it's taking the individual and doing a biochemical or a deep dive and finding out more about what's going on with them inside out. It's more cost effective because, like I said, you're going to stay out of the hospital more, you're going to have less medications, you're going to be less urgent care, and also it's addressing the root causes instead of treating with drugs. It's also a preventative approach instead of just treating the disease. And not only is it high tech, but it's high touch. So this really resonated with me. And I still practice internal medicine because I'm an internist, and I do prescribe medications, but I really focus more on a more natural approach. So in functional medicine, as I mentioned, it's really getting to the root cause. We look at genetics, nutritional deficiencies. We do advanced testing for this. It's not just your regular Quest Labs or LabCorp, it's really more advanced. We evaluate the gut. The poor digestion really affects our health, and we'll go into that more in a minute. But we assess sleep. Sleep is so precious, and it's so good for us. And so there's a lot of ways that we can detect this, but really helping people with their stress. But it's also looking at people's timelines and events in their life. So we look at like trauma or medications or if they've had infections. But one of the big things that I really love to learn about, and I've really spent a lot of time learning about, is toxins. And I'll explain that in a little while, but toxins are really a big problem in our country at this point. So when you have all of these different things that are going on, these are the root causes. They express themselves, like I said, as cancer, heart disease, diabetes, autoimmune is huge, like reflux, all these rashes, anxiety, thyroid issues, or believe it or not, start in the gut, allergies, asthma, weight gain, hormone imbalances, insomnia is huge, and arthritis, infection, depression, constipation, irritable bowel, and chronic fatigue. So we're learning about functional medicine. One of the things that I really was fortunate enough is that because I was becoming certified in functional medicine, early on, there's a doctor Dr. Dale Brosen, who's a neurologist in California, and he did a lot of research showing that if you find people that have early dementia, you can actually reverse dementia. And he has a whole study about this, and he had at least 100 cases, and he was able to publish this, and then he wrote his New York Times bestseller, The End of Alzheimer's, Reversing Cognitive Decline. So we know that a pill does not reverse dementia. That's been proven. But his technique and his training that I went to was really using a functional medicine approach in reversing dementia. And the reason why I'm so passionate about this is because I have a lot of Alzheimer's, Parkinson's, and autism in my family, as I'm sure many of you do too. It's becoming it's escalating as well as a chronic disease. So, we know that disease is either having too much of what you're not supposed to have or not enough of what we need. So in functional medicine, what we do is we find out, okay, what's going on here and how do we balance this? How do we get rid of these bad things and how do we bring up the things that we do need? So when you partner with your doctor, we can determine this by digging deeper and doing more advanced testing. And then once we do, we're able to teach, treat, and educate. And, so we're able to work together to reach your wellness goals. And the reason why, we know that knowledge is power. So this is all about finding out so that we can help reverse these things or prevent. So in functional medicine, it's really a personalized medicine. We're really focused on lifestyle. And so if you look here, we look at environmental factors. We know, like I said, toxins are huge in our country now. We need to have clean air, clean water, clean food, clean products in our body, as well as clean products that we clean our house with. Because toxins are escalating in our country, and so we really educate people on that and try to teach people like better ways of purifying water and air purification and such, as well as food. We also look at sleep, like I mentioned. You know, studies have shown you need 7 to 9 hours of sleep, and you really need to, people who say, like Jimmy, likes to say that he can get by on 5 hours of sleep, right?
I do.
So when people say, you know, I thrive on lower hours of sleep, you know, and that's all fine, you're going and, you know, you have businesses going and all that, but we know in studies that if you're not getting that 7 to 9 hours, and if you're not getting that deep sleep, you're not washing your brain. And that's the whole reason we sleep, is like this glial cleansing is like the brain when we're sleeping is cleansing out from the day, all the debris and the junk and everything. So that's why sleep is so good. And when you sleep, you're gonna have more energy, you're gonna be able to exercise, you're gonna be able to eat right, not be craving carbs, you're gonna be able to lose weight. And so we really work on this, and if people may come in and they're saying, you know, I just don't feel good, and I talk to people and they go, I get up several times in the night to go to the bathroom, and I'm like, you know, you really need a sleep study done, because everybody's like, yeah, but it's just because I have to go to the bathroom. I said, well, it's really, we know this, that when you have to go to the bathroom multiple times in the night, it's because you probably have sleep apnea. So now we can do these home sleep studies. They're so easy. People do them, and no one's complaining about having to go anywhere to do this, and it's so informative, and we can diagnose sleep apnea now. And there's ways of treating this that really restore, because if you're having sleep apnea, that's one of the #1 causes for heart disease and also for brain issues. So that's why it's so important. We also assess exercise and movement, because like I said, you know, we know that exercise is so healthy, not only for the body, but for the brain. And people have to be moving. And it doesn't mean you have to go join a gym, or you have to go get on some, you know, join some group or anything like that. It's just as much as even just getting out and walking every day. But we know now with all computers that sitting is the new smoking. So movement and exercise is so important. And it can be as much as even gardening, or, you know, riding your bike, or just finding what resonates with you that you will just do every day. And then diet and nutrition. So with diet, we know our food is so contaminated. Fast food is just really all chemicals and processed, and it just has so many things that are bad for us now. So in functional medicine, we really emphasize an anti-inflammatory diet, which is plant-based. And it's not so people's like, oh, I'm not going to be able to eat. I have patients come in there, I'm not going to eat that rabbit food and all. Well, you know, just making a few little changes, you know, adding some vegetables here and there. And we go, okay, and this is all part of it. We spend time with the patient, like take an assessment. Okay, what are you doing? Okay, let's just make some baby steps and make some changes. Why don't you just try doing a few things here and there? Because we know, again, being more organic or eating chemical-free foods, like going grass-fed or wild-caught, is better than the processed stuff that we're eating. And also we talk to people about mental health and spiritual, like stress reduction. Everybody's so stressed. So when someone comes in, I will help talk to them, give them like breathing exercises, the deep breathing exercises, teaching them how to take the slow, deep breath, count to 3 or 4, then hold it for 3 or 4 seconds, and then breathe out for even longer, like a count of 6. This, when you're uptight and stressed, if you do these deep breathing exercises, it puts you in what they call the parasympathetic mode. Because everybody's so wound up and sympathetic, that's why the deep breathing exercises stimulate that vagus nerve that slows our heart rate down. It's very calming, and it decreases cortisol. And some other things that we teach is meditation. And there's so many different forms of meditations. There's apps, you can get trained, and sometimes just prayer or just a lot of things are meditation. It's not one specific thing like having a mantra. I mean, even the breathing exercise can be a meditation. And there's several different ones. There's visual, and there's mindfulness, and there's audio, and there's apps that you can use. So we really know that one of the things that I'm going to talk about is gut health next. But one of the things I want to say is, like, having a routine is so important. And like, I like to get up in the morning, go to the gym at 5. I meet Martin and Jimmy there way before I am. I thought I was early, but they're earlier than me at the gym. And having a good routine every day just gets your day going. You just have more energy and you feel good. And it helps your mind, body, and spirit. But it also keeps your muscle strength and your bones and all. So I have a routine that I do. And I don't know about y'all, but since the pandemic, my daughter ended up moving back home with me. And so when I come back from the gym in the morning, I'm, getting my stuff done and everything. And so she literally sent me this video. She goes, "This is literally you in the morning." So I'm gonna turn it. So she's like, "Literally you, Mom." I was like, okay. So basically, going through all that, now I want to talk about the gut, because we know that we are what we eat. That's what we've always told. And the gut is the window to the rest of our body. And disease actually starts in our gut. So this new frontier in medicine is really talking about the gut microbiome. And what is that? The gut microbiome is these little bacteria and yeast, and there's these different archaea, there's different elements in our gut that have a whole ecosystem of their own. Now, they control so many things, and it's hard to believe that, it controls our weight. So many people say, that person can eat anything that they want. They never gain any weight. And I just look at a potato chip and I gain 5 pounds. And so everybody's like, I just don't get it. So there's a lot of genetics. Well, people think, yes, there is genetics. And what we've found out is that the gut microbiome actually has its own DNA and own genetics. So it's not only controlling our weight, but it also is our immune system and our emotions and our hormones. So in looking at this, there's so much research that we have going on, and it's so critical, like I said, in our health and wellness. And there's so many things that play a part in our gut. Now, most people will go to the doctor, they say, my gut's just, I'm bloated, I'm gas, I have a reflux, I'm either, diarrhea, constipation. Sorry to talk about these things, but as a doctor, I talk about this every day with my patients. But they say, I've been to the gastroenterologist, and I go, and they scoped me, and they say, I don't know, everything looks fine, here, take a pill and send you on your way. Well, these people come to me, and it's like, oh my gosh, functional medicine, this is one of the main things. We start with the gut. And so you can see one of the things that we start with is like how you're born. If the bacteria that you get from a C-section versus a vaginal is so huge, it really dictates what your gut bacteria is going to be in life, how you're birthed. Then how they're fed. So if they're bottle fed versus breastfed, you get different bacteria. Even stress in life, like exercise, if you overtrain, is a lot stress. And also, any kind of like metabolic or physiologic stress is another one. So diet. Our diet really puts a big strain on our gut. All this processed food that we're having, the chemicals that are in the food and water, like I said, alcohol, all these things are just really bad on our microbiome. But not only that, pharmaceuticals are one of the biggest damaging to our gut, like anti-inflammatories, antibiotics, even the Prilosec or omeprazole, the stomach acid blocking. Everybody says, oh, but I have this reflux, I need to take this pill. But what it's doing is blocking your acid, and then you need this acid to digest your food and so you can absorb your nutrients. So everybody's like, but there's ways that we can get people off of this stuff and turn them around, and you don't have to just rely on this pill that's damaging and also decreasing your nutrients. So, just where you're born and even stages of life cycle will affect all of our gut microbiome. So has anyone ever heard of the gut-brain axis? Okay, good. So when you're stressed, your gut's really upset, or let's say you have an upset stomach, you just don't feel good mentally or physically. And, everybody, we talk about that gut-wrenching moment or using your gut instinct. So believe it or not, 90% of our emotional hormones are made in our gut. And people don't realize this. So if you're damaging your gut, it's going to play a big part in how you're feeling emotionally. So another big thing is our gut immune axis. During the pandemic, we have really come into really talking about the immune system. And so many people are like, well, everybody's like, oh, I gotta get my immune system. And I love that finally, like I said, I was a traditional doctor, changed to functional medicine. A lot of the doctors in town were like, oh, she's talking about all these vitamins and supplements and all that. Well, what's so funny now is how many people now are on vitamin D, vitamin C, zinc, all this stuff to prevent COVID. So it's like now finally people are finally catching on what functional medicine is all about. So in our immune system is in our gut, 70% of our immune system. So if our gut's inflamed, then our body's inflamed. And if you have inflammation in your body, then you are going to have autoimmune issues and all kind of other chronic diseases. So what we like to work on in our gut is talking about why are people having gut inflammation. So has anyone ever heard of the term leaky gut? Okay, good. People are starting to hear this. Before, people were not. Everybody was laughing about that term. And now it's really become, people are really realizing that this research is real. So in leaky gut, I explained what happens. So normally we have our gut cells, or our gut is like a tube that, everything goes through, and the cells are all lined up, and you have to digest your food. They can't get into the body unless they're broken down, and then they go through the cells, and then they get the bloodstream. Well, that's normal, and normally we have these little tight junctions right here that I call them the glue, that keeps the cells really tight. Well, what happens is that now we start having things like gluten, viruses, bad bacteria, toxins, things that come in here and start irritating these cells, and it breaks these little things, and then now all of a sudden you're getting all these bad products going straight into the bloodstream and not going through the cells, so you're getting bigger products that are damaging. And so our immune system will see them as foreign and attack them and make these immune complexes. Then these immune complexes will go throughout the body, and then they'll set up shop in different organs like your thyroid, your joints, you get skin rashes, you get allergies, you get just brain fog, all these inflammatory things. So this was what leads to autoimmune. So when these little complexes go to those organs, like the thyroid, then all of a sudden the body recognizes the thyroid as foreign as well, and that's when you get Hashimoto's, which is an autoimmune thyroid. Or it can go to your joints, and you can get rheumatoid arthritis, or psoriatic psoriasis, or psoriatic arthritis. I mean, just different things like this. Any kind of autoimmune, that's what autoimmune is your body fighting your own immune system, attacking yourself. So what we do is we start getting people off of things that causes inflammation in the gut. So the first thing that we like to do in functional medicine is eliminate things that are making people sick. So the Elimination Diet has had so much research, and it has proven that it is better than any allergy test that you could do to find out if you're allergic to certain foods. Everybody's like, well, I don't know, I'm just bloated, and I can't lose weight, and I just don't feel good, and all this. And so we start treating with this anti-inflammatory diet. It's really like a Mediterranean diet in a lot of ways. But what we eliminate is gluten, which is the protein in wheat, and there's some other grains too that has gluten. We also eliminate dairy because that's really pro-inflammatory now, and I'll explain a lot of this in a minute why. But eggs, peanuts, soy, and corn is another one. And we go with a more plant-heavy because it's not saying you have to go vegan or vegetarian, but you want to go more plant-heavy because that is really is an anti-inflammatory diet. And if you're gonna do meat or your protein, you want to do about the size of your hand or a deck of cards, and use meat more as a condiment. And if you're going to do, which we all eat meat and such, you want to go with hormone-free. You want ones that are not fed grains, that are chemical-free, and like grass-fed beef or wild-caught fish, not farm-raised, because of, again, getting rid of all the chemicals. But we also want to do a lot of berries, because we know berries are very good. They're antioxidant, and we want to go organic. And the reason why is because, like I said, we our world is just so full of toxins now, with plastics and chemicals and herbicides and pesticides. And all these toxins, the reason why they cause, all this buildup causes stubborn weight gain and can't lose weight, exhaustion, headaches, insomnia, brain fog, irritability, skin problems, muscle aches, body odor and excess sweating, and constipation, is because, toxins love to go into fat cells in the body. That's where they store them in the fat cells. I don't know if you've ever heard the expression, the solution to pollution is dilution. And what that means is that when these toxins go into our fat cells, the fat cells go, ooh, I'm gonna die, I really need to dilute these toxins. So I'm gonna increase in my fat cell size, I'm gonna increase in fat cell number, and that's where the weight gain comes from. We know that obesity leads to inflammation in the body. So, what we start doing is one of the first things we do is we talk to people about eliminating some toxins. And one of the first things is food. So there's a thing, has anyone ever heard anything about the dirty dozen? Okay, good. So the dirty dozen are the foods that you need to go organic in. So the dirty dozen must be organic because of the pesticides. And you can see here, the dirty dozen at the top of this list right here is strawberries is one of the big ones, spinach, kale and collard greens, nectarines, apples are big, grapes, and there's a whole list of them. Celery is a really big one. So you go, well, how do I know which ones I need to go organic with and which ones can I not have to do organic? Well, the Environmental Working Group, EWG.org, you can download it, there's apps you can put on your phone. They will tell you the dirty dozen foods, and they also will give you a list of the clean 15, which you don't have to go organic with. So we also like to really emphasize, like I said, a plant-based, non-inflammatory foods, omega-3s, like salmon. I know a lot of people won't eat sardines and anchovies, so you can take fish oils, are really good. You can do flax seeds and chia seeds and nuts. Also, we always say, eat the food that God made, not the food that man made. Man-made food has so many chemicals. So the antioxidants, like I said, polyphenols is a big word, but basically what that is just eat from the rainbow. You want to eat every day a color. You want red, orange, green, and purple, and blue, all these different colors every day, because these are our antioxidants that help us decrease oxidative stress in our body. Now, coffee's on that list, but you always want to make sure that it's not, coffee is one of those things you have to be careful about mold and things like that, but pure coffee is good. Like I said, the organic berries and colorful fruits and vegetables. Also, turmeric is very good. That's why everybody talks about curry and turmeric and such. Vitamin D is really not a vitamin, it's an immune modulator, but it is very good for decreasing inflammation. And of course, ginger for digestion and green tea. So instead of eating dairy, we tell people do nut milks like almond milk, coconut milk, cashew, whichever one you like. And use an olive oil and grapeseed oil. Don't use like the canola oil and vegetable oils. Those have a lot of trans fats and they're very pro-inflammatory. So what I want to do is just show you like a patient improvement case. So I have patients that come to me all the time, And believe me, like I said, I was a traditional doctor, but now they're coming there saying, you know, I've been to my doctor and they've run all these tests and they say that I'm fine. They say I'm healthy. And I'm saying, but I just don't feel good. I'm tired, I can't sleep, I have hormone issues, I can't lose weight, my gut's inflamed, I'm brain fog, my joints ache. And they're saying, you know, and my doctor just told me, he said, well, you know, just exercise more and eat less. And they're like, and my labs are fine. So I said, so I get these people that come in and they're like, I'm just sick and tired of being sick and tired. Can you help me? So with the functional medicine approach, we do a lot of these and then some on work and patient. It's a lot of gathering information and spending time with the patient. And it's not that long. It's just the patients love it. I just don't, to this day and age, I still don't understand how I used to do it or how people do it. But that quick in and out, the insurance companies say you can only talk to them about 1 or 2 problems. I'm like, how do you ever find out what's wrong with these people if you're limiting what they can say, what issues you can go over, and how long you spend with them? I just don't get it. Maybe that's why we have such a chronic disease problem in America. But with a functional medicine approach, I get these people, and I'm not just, it's true. It took me at first, when I started doing this, I thought, I don't know, I kind of see, so I just tried a little bit at a time, different things with patients, and I have seen dramatic improvement in people. They're feeling better, they have more energy, they're sleeping, they're losing weight, their hormones are better, and but they also have increased vitality, and they're looking forward to living longer and remembering it. So this is all done not through a pill or a Band-Aid, but through a natural way that our bodies are made to function. That's why it's called functional medicine. So in summary, I'm going to say that the future of medicine is here. And it's called personalized functional medicine. And it is a membership practice. And the reason, I hope you can understand, is because to spend more time with the patient and have less people so that you can give quality time, it takes a membership. It's a vehicle that we are using to help people get better. So it's partnering with your doctor, one that knows you and one that you know, and one that you trust. And it's spending increased quality time. And it's getting to the root cause instead of just a pill for an ill. And it's also reversing things more naturally and more holistically. So again, we like to treat from the inside out, and it's thinking outside of the box, and it's using the cutting edge research today that's always evolving, and doing a proactive, preventative approach. And it's, instead of doing sick care, it's doing good health care. So my personal passion that has got me to this point, down this long road through our changing of our medical system, is that I want to reverse this rapid trend of our failing healthcare. And I really want to educate people on a healthier, more natural way so they can have more longevity and enjoy the one life that we are given while we're on this earth. So in closing, I just want to thank you all for having me here. And if you want to follow me on Facebook or Instagram, check out my website. I have blog posts. Also, you can sign up for my newsletter. And I am going to be doing a lot more educational videos and newsletters. So you can stay tuned. If you want to follow me, I would love for you to do that. And if anybody has any questions, I'll be happy to answer them. Does everybody understand what functional medicine is now? Okay. Well, I have some cards also in the back, so if anybody would like some, or if you want to contact me or have any questions or any concerns, I'll be happy to answer y'all. I'll be here, I guess, through the afternoon. Okay, thank you.